Hello everyone, my name is Benta Terry.
Hello everyone, my name is Dr. Vyas. I'm a senior consultant physician and specialist in cardiology and diabetology.
Welcome again to another episode in Clinics with Dr. Vyas, and today we are going to discuss about heart failure.
Okay.
Doctor, welcome.
Thank you.
Now for the start, what's heart failure?
Heart failure is the inability of the heart to pump blood properly so that the end organs, that is the tissues in various parts of the body, they get proper circulation so that they can receive the oxygen and nutrients. When this pump failure happens, that's when we call it heart failure.
Okay. And what are the symptoms that one can look out for?
So heart failure, clinically, it can be two types. Right-sided heart failure and left-sided heart failure. Left-sided heart failure is the most common one, which usually happens because of uncontrolled blood pressure. So left-sided heart failure is characterized by symptoms such as breathing difficulty on exertion. That is, when you are walking, you usually don't feel breathless. Okay, or taking steps, usually don't feel breathless for single flight or double flight of flights, a flight of stairs. Okay, so you are used to certain physical activity, but now when you are doing that, you have breathing difficulty. That is called breathing difficulty on excursion. Okay, on exertion. Okay, so that is one of the most important features of left-sided heart failure. The second one is, this is what we see as doctors. There is presence of S3 gallop. That is, other than the two heart sounds, lub and dub, there will be a third heart sound when we examine the patient with stethoscope. Okay. These are the hallmarks of left-sided heart failure. The right-sided heart failure, when it happens, usually people develop swelling of the feet along with breathing difficulty. Okay. And also people develop, there is something called elevation of jugular venous pressure. The neck veins, they get dilated. So these are the features of right-sided heart failure. When both of them they happen, we call it congestive heart failure.
Okay, that is a good explanation on symptoms. But now for patients or our viewers back at home, what could they look out for so that they know now I can see the doctor, or do they have to wait till then, or what's the right time for a diagnosis?
Especially when you are having palpitations. See, there are 6 cardinal signs of cardiac disease. Okay. Chest pain, SOB, that is shortness of breath on exertion, swelling of the feet. Orthopnea. Orthopnea means in the night when they are sleeping, suddenly they have to get out of the bed in the middle of the night to catch a breath. Okay. That is called orthopnea. So when you are sleeping, you develop breathing difficulty. So this is the 4th symptom. 5th symptom is palpitations. The heart feels as if it is racing. Okay. So palpitations. And the last and most important thing is syncope or pre-syncope. That is the feeling of blacking out or loss of consciousness. These are the 6 symptoms of heart failure. Usually when any 3 of them are present, you have something wrong going on with the heart. So that's when you have to consult the doctor.
Okay, you are a senior cardiologist, doc. Now when a patient walks in, what are the tests you use or the marks so that you can now say this is heart failure? Like, are there tests to diagnose heart failure? And what are
one of the most important tests we do is ECG. ECG is the most important thing we do. ECG is the electrical activity of the heart. So ECG is one of the most important things to study the heart. The second one is an X-ray. X-ray will tell us if the heart is dilated or enlarged, and also if there is any fluid buildup in the lung, which usually happens in left-sided heart failure. Okay. Then third and most important thing is echocardiogram. Echocardiogram, we are actually visualizing the heart by using the ultrasound. So how is the thickness of the cardiac membranes or the cardiac muscle? How are the valves functioning? What is the ejection fraction? That is the pumping capacity of the heart. Is the right ventricle functioning well or not? All these things we'll know with echocardiogram. And the last and most important thing in context of heart failure is proBNP. ProBNP is a blood test we do, and when it is raised, we suspect heart failure.
Okay. Is there treatment for heart failure?
Yes. In previous days, there was not effective treatments, but there is a new class of drugs which have come in the market since last 10-15 years. In Kenya, since last 5 to 7 years. This is called sacubitril valsartan. This is a very promising drug which can be used in many patients, and we can reverse the symptoms of heart failure. We may not be able to reverse the heart failure per se, but we can reverse the symptoms.
Okay. Doc, now I want to give you a scenario. So, like layman or us home, we want to say if that is heart failure before diagnosis. You're walking on the road, suddenly you get like a shortness of breath, you feel dizzy, and you get unconscious. Like now there's palpitations, there's dizziness, and there's unconsciousness. At first you mentioned 3 of those 6 markers. Could you call that heart failure, or you have to rush to a facility?
These symptoms are only indicators.
Okay.
There can be many causes which lead to heart failure per se. Okay. But every case of having these symptoms need not be heart failure always.
Okay.
Okay. But these are the cardinal manifestations of heart failure. So when you have a patient like that, you have to rush the patient immediately to the hospital, and the doctor will decide what is the diagnosis.
Okay. And are there risk factors? Let's say a drunkard, a smoker.
Yes.
Okay.
Smokers usually get ischemic heart disease, which can lead to heart failure. Alcohol itself can affect the myocytes, and which can lead to enlargement of the heart. This is what we call alcoholic cardiomyopathy. Okay. And apart from that, rheumatic heart disease is one of the most common causes of heart failure in Kenya. Rheumatic heart disease means it's an autoimmune reaction which destroys the valves of the heart, and the valves, they don't function well, and that slowly progresses over a period of time. And because the valves are not functioning well, heart is unable to pump well, the cardiac workload increases, and patients ultimately develop heart failure. And this is the most common and recognized cause of heart failure in Kenya.
Oh, nice. So that is lifestyle generally.
Lifestyle is alcohol and smoking, and also high cholesterol, which can lead to again ischemic heart disease. But rheumatic heart disease, in the post-antibiotic era, it has decreased all over the world. But because the technology and the medicines, they have come late in Kenya, we still find rheumatic heart diseases in Kenya.
Okay. Doc, there's a time back now as a doctor, you ever mentioned on a machine that could be placed on the heart or something. Is it in Kenya available right now? Still not
It's
yet?
called ventricular assisted device.
Yes, that
ventricular assist device helps in bridging the gap between heart failure and cardiac transplant.
Yes.
Okay. Cardiac transplant doesn't happen here in Kenya, but in advanced countries it is happening on a regular basis. But the availability of hearts also is very less in the entire world. So to bridge the gap, we do something called ventricular assist device, where we attach a device to the heart, pipes to the heart, and those pipes come out of the chest, and there is a device which you carry around all the time, and it pumps the blood.
So mentioning that means that is also a form of treatment, a management.
It's a form of treatment where medical management fails, and patient should be on something like nothing is going to save him. So you go for ventricular assist device. Okay.
Now, last but not least, Doc, can someone live with heart failure for long, or it's a death sentence?
No, it's not a death sentence with current days technology. The identification is very important. If we diagnose the people early, they can live meaningful lives for many decades actually.
So when you mention early means heart failure has stages. Does it have stages?
Heart failure has stages. Yeah.
Okay, so one can live if it's managed well for long.
Yeah.
It's not a death sentence.
Yeah.
Okay, thank you, Doc, for that. I think us and all the viewers have the information now for heart failure. Thank you.
Yeah, thanks a lot.
All right.
If you had liked this video, please like, share, and subscribe.